I teach anatomy and physiology here at Manchester High School. I know Jaron here and I know Caleb. That's pretty much all the names I think I know. Alright, so the reason Ms. Lambert asked me to come speak to you guys is because I have a pretty unique pathway from college to where I am today. So I'll just start off by, at the beginning I guess. So I graduated high school from a tiny town in central Connecticut called Portland. I only had about 76 kids in my graduating class. And from Portland, I went to Sacred Heart University. And Sacred Heart University is down in Fairfield. I don't know if anyone knows. And part of the reason I chose Sacred Heart was because they had a great nursing program that I was accepted to. In high school, I had about my range of grades was about like A's and B's, high A's to high B's. So I was an average student, about a little bit above average. And I was accepted into Pace University, I was accepted into Sacred Heart nursing program. That's what I wanted to be when I was in high school. I wanted to be a nurse. And the second reason I chose Pace is, oh my goodness, I can't talk anymore.
Well, you talked for 53 minutes.
I know.
It was great.
Yeah, so the second reason I chose Sacred Heart is because I was riding horses at the time, and I rode D1 for Sacred Heart University. Is the second reason I chose them, their equestrian team. So I went to my freshman year. I took all the typical nursing courses. I took anatomy and physiology. I took intro to nursing and all the maths I needed. And from there, that first year, I rode for the team, did all of that, and I kind of decided halfway through my year that I don't think nursing was for me anymore. My mom was a nurse. She was an RN, so I always imagined myself being a nurse. I grew up in a medical household, so my mom was always talking about medicine, talking about nursing. I really liked the way that she always understood what was going on with us when we were sick, and I was hospitalized at one point for appendicitis, and she understood what was going on. I had surgery. She always just felt like she knew what was going on, and I always admired that quality and kind of wanted to have that knowledge base as well. So that's why originally I kind of chose nursing. My mom was a nurse. I knew it well, and I really liked medicine. I loved learning about the body. I took anatomy in high school. I was fascinated. I loved it. So it just kind of seemed like the right fit. And I think what kind of deterred me from nursing my freshman year is when I realized that my first experience with nursing was going to be in a long-term care facility, so a nursing home. And I kind of realized that bodily fluids really grossed me out, like really grossed me out. Especially feces was really gross. Like that just was so gross to me, and I knew, and like the other nursing students were talking about changing adult diapers and what they had seen and what they had done, and I was like queasy, and I was like, I can't do this. Like I can't be a nurse. So that was kind of, at that point I was like, no, I don't want to be a nurse anymore. So my freshman year I switched my major at the beginning of my sophomore year from nursing to bio, so I stopped the nursing program and just became a regular bio major at Sacred Heart with the idea I was going to go to PA school and become a physician assistant. So who here knows what a physician assistant is? So what is it? What does a physician assistant do?
They're kind of like a doctor, but they're not. They do patient care.
Right, perfect. So a physician assistant is what's called a mid-level provider. So for those that don't know, like if people, I say I'm going to be a PA, they don't understand what that is, I always tell them it's like the step down from a doctor. It's kind of an easy way to describe it. So a physician assistant is a mid-level provider that can go in and diagnose, treat, prescribe medicine, do small procedures, all under the supervision of a doctor. So I'm not saying like the doctor like comes in and watches you over your shoulder. The doctor will just review your documentation after and make sure that everything is kind of okay. And it's neat because as a PA, I get to do the things like a doctor, but I don't have, there's a lot of benefits because I don't have liability, I'm under the doctor's insurance, I don't carry my own malpractice insurance. So it's interesting, and I'll talk about that in a little bit. So going into my sophomore year, my older sister Caitlin, who's about 5 years older than me, was accepted into PA school. And that's the first time I had heard about what a physician assistant was. So that's part of the reason why when I switched from nursing into bio at Sacred Heart, I switched to bio with the intent that I would go to PA school. That was my thought. So I switched at Sacred Heart from nursing to bio so I could go to PA school. So when that happened, I was like, okay, now I'm a bio major, I'm going to be a PA. And then about 3/4 of the way through my year at Sacred Heart, wasn't really riding too much anymore, and I just realized, like, I don't really like Sacred Heart. Sacred Heart's not really the greatest school for me. It's really super small. It's kind of closed off, really cliquey, kind of like high school. And I was just kind of over it. And I was in the library one day, and I was studying for a bio exam. And I called my mom and was like, I am miserable here. I don't like it. I don't like, no, we're not gonna do that, thanks. All right, I don't like it. I don't want to be here. So I called my mom. My mom's like, well, why are you freaking out? She's like, just apply to UConn and like just go to UConn. And I was like, oh, I guess I could apply to UConn. I guess I could go to UConn. All right. So I put the application in for UConn to transfer the day before the application was due. This was like a last minute decision. And I got my acceptance to UConn, and I was like, all right, I'm gonna go to UConn. So I transferred, went to UConn, and I loved it. I fell in love with UConn. I highly recommend UConn to anyone. I'm obviously wearing my UConn apparel today. So I went to UConn. So already you can see that like my college career and pathway. Isaiah, we're not going to do this. We're going to stay focused because it's rude that I'm up here talking and you're goofing off. Okay? Because I am a teacher here, so I can call your administrator. You can go down there. All right? Fair enough? Okay. All right. So you can see already my pathway from the beginning of college was not clear, right? I've changed my major. I've changed my school. So I've kind of like a little bit of a zigzag path, if you will. So now I'm at UConn, and I'm a bio major. And I like it. I'm taking orgo-chem, I'm taking microbiome, I'm taking genetics. I'm still in the mindset of I'm going to go to PA school. So my summer going into UConn, I got my CNA, my cert, to be a nursing assistant. So I could get my hours to go to PA school. And I got a few hours here and there, and at school I'm really focused on doing all my classes, things like that. Spring semester of my junior year, my dad gets really, really sick. He gets diagnosed with ITP, which is idiothrombocytic pneumonia. I can never remember the specific words, but he almost died. So the ITP is a blood clotting disorder, so his body was destroying the platelets in his body, and there's no reason for him to be alive. He should have just bled out. So that happened. That was very obviously upsetting. So that was something that was rocky. My grandfather died. My dad's dad died around the same time. He was diagnosed with cancer. Around the same time my dad was diagnosed with ITP. So that was all happening in my spring semester. I made it through, still got great grades. Was like, do I want to be a PA? Is this what I really want to do? I don't know. Like, is this something I want? And then, so summer passed. I didn't get any hours during my summer. And then fall, at the end of the summer, beginning of the fall semester, my senior year, my parents unexpectedly announced that they were getting divorced. And this was very unexpected. I did not know it was coming. I did not see it coming. And if anyone in here has divorced parents, they know how hard that can be, especially as they were going through a divorce as it was my senior year in college. So kind of all of that made me go, okay, no, I don't want to be a PA anymore. I don't know what I want to do with my life, but I know I don't want to be a PA. It's going to be too hard. I don't know. I don't have the hours. I just can't do it. So I told my parents that. And they said, that's okay, that's fine, but you need to do something. You can't just graduate from UConn with a degree in biology and sit at home, because a degree in biology, unfortunately, is not a, I want to say like lucrative major. There's not much you can do with just a degree in biology. You can work as a lab tech, you can do things like that. I didn't want to do that. So I was walking in the Union one day at UConn, and I saw a flyer that said, get your master's and certificate in teaching in 1 year. So I was like, teaching? I could be a teacher. I could do that, right? Yeah, I want to be a teacher. So that was my new goal. I was going to become a teacher, and I already had so much science. I was like, I'll be a bio teacher. It's perfect. Applied to this school. It was still UConn, but West Hartford campus. I got in. It was a year long. And something never really quite felt right, though, during it. I never really, I don't say I didn't like it, but nothing really ever excited me about it. I was never like, yes, I get to go to class today, or yes, I get to go student teach today. I was kind of just like, oh yeah, I can do it. I'm good at it, but I can just do it, and it wasn't anything that ever really excited me. So I got through that. Obviously, I applied right out of grad school to Manchester High School. Last year was my first year, and I started teaching here. And it was fine. It wasn't like I was here and I was miserable, but I never really found a passion for teaching. I liked it, I was good at it, I really liked the kids, but I was never really passionate about it. And I'm someone that cannot go through my life and go through the next 30 years in a career where I'm not completely passionate about it, or it's not my true passion. Because I do have some passion for teaching, it's just not my true passion. And so I had student loans, and part of helping to pay for that student loans was like I got a job on the weekend. And so I was working as a certified nursing assistant because I still had that cert, and I was working 7 days a week. So I was working the 5 days at school, and then I was working Saturday and Sunday on the weekends as a nursing assistant at a walk-in clinic, an urgent care clinic. So if you guys, they're like kind of popping up everywhere, those clinics that you can go to, and they'll it's like a doctor's office, but a little bit faster. It's faster than the ER.
My mom works at one.
Yeah, so yeah, they're coming up everywhere. They're really popular right now. So I worked there on the weekends. And the defining moment for me saying, okay, I want to go to PA school and or at least I want to be in medicine, was when I started to enjoy my job as a CNA more than my job as a teacher, I should say. And not to say I don't want the impression that I hate teaching, because I don't. I do like teaching. But when I was a CNA working that job, I was the lowest at the totem pole. Okay, so CNA is like, I don't want to say the lowest of the low, but you are. You're the lowest at the totem pole. You only have 2 weeks, or sometimes it's only 2 weeks of experience or 2 weeks of training. You're doing the grunt work. And doing the grunt work at an urgent care clinic, I found more passion in than teaching. And at a high school, as a teacher, I'm like kind of at the top of my game, right? I'm kind of, that's it. Like that's where you kind of cap off. So that kind of made me think, and I was like, you know what, and I started shadowing PAs at the urgent care clinic, and I was like, this is what I want to do. I want to be in medicine. I still love medicine. I'm fascinated by it. I want to diagnose. I want to treat. So that was my decision to, all right, let's get back on this pathway and let's start thinking about PA again. So for PA school, which is different from any other type of school, different from if you're applying to a nursing school or if you're applying to med school, you need patient care hours. So what that means is you need hours in a facility touching patients, like physically helping patients. So last year I worked, like I said, I worked 7 days a week. I worked Saturday and Sunday at the urgent care clinic, and then I came and taught for the 5 days. Between that and then going into the summer, I got a job at a long-term care facility, and I was a CNA at that long-term care facility. So with all that, I was able to dock 600 hours of patient care experience. Typical PA schools run from anywhere from 200 to 2,000 patient care hours. Obviously, the more hours you have, the more competitive you are as an applicant, right? So I had 600, so that was pretty good. And it was funny, I think the real defining moment for me was A, when I was working as a CNA at the urgent care clinic, and then B, when I was at the nursing home, at the long-term care facility this summer, and I faced my fear, right? Because what did I say at the beginning? What was I afraid of? Feces. Long-term care facility, changing adult diapers. That was my fear, right? And I did it this whole summer. And guess what? It's not as bad as I thought it was going to be, right? Was it stinky? Yup. Was it gross? Yup. Did I do it? Yup. So that's kind of like, that was a defining moment to me where, wow, this is my biggest fear about going into medicine, but yet I still can do it. So that was kind of like the yes, I can do it factor, because I kind of had all these doubts in my head, like you can't do this because of this, you can't do that because of that. So that was kind of another defining moment. So with all that combined, I put my application in to about 8 different schools, which cost me probably about $1,000 to apply to PA programs all throughout the Northeast. And I did that in August, and I heard back in October that I got an interview at Pace University in Manhattan. Which was great, which was a big step. I was shocked. I really didn't think I was going to even get an interview. I thought they were just going to flat out reject me. And so I got an interview at Pace in October. I went down in November. I still remember the date. It's November 11th. It was a Tuesday. It was Veterans Day. So I went down the day before, because obviously it's in Manhattan, so I wanted to make sure I was ready. Never been more nervous in my whole life for an interview. So I got to Pace. I got upstairs. You take the elevator up. It's Manhattan. You can just. I don't hate the city, but I'm not like really well versed in the city, so like that made me nervous on top of it. And I get up to the interview room, and I walk in the room. There's like 35 other people standing there waiting to be interviewed. So I was like, wow, okay, this is gonna be a big group. And kind of a funny side note, I also walk around the corner and almost run straight into my sister's ex-boyfriend. who happened to be at the same interview as me. So that's kind of funny. So there's about 35 other people. So that was intimidating because I knew there was only 200 spots, and I knew they were interviewing like 10 times. So if you think about it, 30 people each time, 10 times, it's like 300 people. Oh no, I'm sorry, a little more than that. And there was like half of what they could take. They could take 80 people, they were interviewing 200, excuse me, about 200 to 300. So I knew there was 80 spots. I knew there was 35 people at my interview, I knew there was 10 interviews. So I knew there was like 300 people for 80 spots. So that was intimidating. So the process was, I got there, they fed us breakfast, which I didn't eat too much because I was so nauseous and so nervous, but I ate because I knew my blood sugar would be low if I didn't want to stand up and like pass out as they call my name to be interviewed, because that would be so embarrassing. So I made sure I ate. They took us into a room, they gave us a presentation, and they told us that this interview is just as much for you to get to know us as for us to get to know you and figure out if we're a good fit. And then they gave us an essay. So that was the first part of the interview. We sat down and we wrote out an essay, handwritten, wrote out an essay for 20 minutes. The topic had to do with ethics. It had to do with if your patient, if you find out you prescribed your patient an antibiotic they're allergic to, what do you do? And it says you talk to, and like part of the prompt was like, you talk to your attending physician and they say, don't worry about it. Like, what do you do? So obviously I spoke about how I would still contact the pharmacy, contact the patient, make sure this patient doesn't take the medication, because although my attending physician told me not to, that's still my responsibility, yada, yada, yada. So I wrote that out, felt pretty good. And then they shuffled us into another room where we sat for about 6 hours for the interview. So there was 30 of us and there's about 5 interview people. So every 5 minutes or so the phone would ring. There's like a black phone in the room and the woman would pick it up and call one of our names. One of us would get up, we would go around the corner, down the elevator, and into the interview spot, and the person would pick you up and then interview you. So we're all sitting around, I get called about halfway through, go down for my first interview, the woman's like stone-faced, very serious, and I was like, I don't really know if I did well. You know, when I got back, the people were like, what did they ask, what did they say? And a lot of people, when they got back, they didn't want to talk because they didn't want to give other people an advantage. But I don't know why, but that day I just felt like, if I'm going to get in, I'm going to get in. It doesn't matter if I tell people like how the interview went. So I would tell people like, you know, they asked personal questions. I didn't give them like any like specific details, but I did give them some details. That kind of made people around me more relaxed too. So I think that just like gave out good vibes at least. And then I went down for my second interview. That one I felt went better. The woman was more receptive, had more facial expressions. And so then I went back up and we're all sitting there waiting, and we're waiting. And then they start calling people for a third interview. And we're all like looking around going, wait, that person's already gone twice. What do you mean they're getting a third interview? And then like the room starts buzzing. We're like, third interviews, is that good? Is that bad? And the woman at the phone is like, oh, no, it's nothing. Don't worry about it. It's random. And we're like, it's not random. Like, why would they do it randomly like that? Like, what is this third interview? I didn't end up getting a third interview. My sister's ex-boyfriend did though. And it turns out that third interview was, the 2 interviewers came out and separately said yes or no, and if you were on 2 separate piles, they gave you a third interview and a deciding person. So that was that third interview piece. That third interview, either you got in or you didn't. So luckily mine, I guess with my 2 interviews, my people said yes. So it's just interesting as a little insight to the interview process. After 6 hours, so I got there at 7, I didn't leave until like 1:30, 1:45. They showed us the facility, other students came in to talk to us. But the thing is, too, you have to remember at an interview like that, you don't know who's a student or who's like a second, like an interviewer almost, right? Because if you think about it, everyone in that program has to be over the age of 21, 22, because you have to have a bachelor's degree. So Joe Schmo could be walking in telling me he's a student, but maybe he's actually an interviewer, and he is trying to get people's personalities without being in his formal interview setting. So I made sure I was on point the whole time. I didn't want to say anything bad. I didn't want to like put down other programs, put down other things. I made sure I asked good questions, things like that. We toured the facility. It was really cool because I saw all the cool stuff for the facility. So I left thinking like, wow, now I really want this. And that kind of stinks. Like it's good because I got the interview, but now that I've seen this, I want it even more. So we left and they told us, you will hear within 3 weeks. 3 to 4 weeks, yes or no. So I was like, wow, that's going to be the longest 3 weeks of my life. And of course that whole week, so I'm back at school now, that whole week I'm scanning through my emails, constantly loading them on my phone when I'm on break. Nothing's coming in, nothing's coming in, nothing's coming in. So Friday at 2 o'clock, for us, our work week's done, right? We're kind of like, as teachers, we're done. So I didn't really think anything of it, and this is Friday the 14th of November, I still remember the day. And I was actually waiting for the soccer coaches that day to come talk to me about something, and I was going through my phone, and I opened my email, and I closed it. I was like, oh no, I don't want to see that. So I just hit the center button, but I didn't close it all the way. So I hear that noise that your phone makes when there's an email, and the email thing drops down up top. Like, you know what I'm talking about on an iPhone? And I can see it says Pace University, and the subject is grad admissions letter. So automatically my heart like goes right into my throat. And I was like, oh my God, oh my God. I was shaking, and I opened it, and I just read the line, we're like, Colleen, we are pleased to inform you that you have been accepted into the physician assistant program here at Pace University. I start crying, call my mom. She can't understand me because I'm crying so hard, telling her I got in, and then when she finally understands me, she starts crying, and I call my siblings, I call everyone. But the thing is, when I hang up, I can't tell anyone here. So I'm at school, so now I'm like, great, now what do I do? So I, of course, accepted the offer. I put in my $1,500 that they require for a deposit fee that weekend. So it's very expensive, obviously. And I am now preparing myself to start July 6th. That's my start date. So my last day of school will be the last day of school here. Then I will go ahead and move down to Brooklyn. So Pace University is on the Lower East Side in the Phi District in Manhattan. So I'm going to live in Brooklyn right across the bridge because it's cheaper. And it's just a little bit more quieter in Brooklyn than it is in, especially the Lower East Side of Manhattan. And then so I start July 6th. I go to school Monday through Friday, 8 to 4. I test 2-3 times a week. And then I have 2 weeks off in August. So I have the last 2 weeks in August off. And then the fall semester, I go right back in, start my didactic full year. So I go from September to August. Classes Monday through Friday, 8 to 4, testing 2 to 3 times a week. So I will have tests 2 to 3 times every single week for the next year. Like no weeks off. I get 1 week for Christmas, and that's it. So it's very intensive, very crazy. I'm getting slightly nervous and a little apprehensive because now I've been out of school. I've been out of undergrad where I was a science major for 3 years now. I've been out of graduate school for 2. So I'm a little apprehensive. And then once next August comes around and I end my didactic year, I start my clinical year. So clinical is when you actually go out and I'll be under like a preceptor that will teach me how to, I'll already know how to do it, but I'll be getting my experience as a PA. So we do 5-week rotations, and we have 9 different rotations. So it'll be like holding a regular job. I'll be going every day or whatever their schedule is for me. So say it's like a primary care facility, like your regular doctor's office. I'll most likely be going in Monday through Friday from probably like 8 to 6. If I'm working in an ER, it might be night shift, it might be day shift, it might be every 3 days, it might be every 4 days. I have to go when they want me to go. So that means for the next 2 years, I can't hold a part-time job. This is my full-time job. I can't work on the weekends. I have to be studying. So it's a full-time commitment that I need to make to this program. Once that's over, I'll end that in August of 2017, so it's 2 years. And once that's done, I'll start prepping for the PANCE exam. Not like your pants, but PANCE, P-A-N-C-E, Physician Assistant National Certified Exam. So once I take that, I will, fingers crossed, pass that, and then I will be a certified physician, what do they call it? P-A-C, yes, P-A-C, Certified Physician Assistant, which means I can practice. So from there, I will find a job, hopefully. In what, I don't know. My gut says my gut says pediatrics because I do like kids so much, and I've always had an interest in pediatric oncology, so cancer in kids. So that's my first instinct to say, but I'm going to keep my options open and keep my mind open when I go into my different clinical sites to see what truly is right for me. But I think one of the big points I want you to take away from my story is it's okay to not know what you want to do, and it's okay to change your mind, because it all comes out in the end, for the most part, okay? So from my experience, you could tell I did not take a straight and narrow path in college. I didn't go into college knowing what I wanted to do and come out and start my career right away. I went to college and I switched my major once, switched my school once, and then now I'm switching my career. But it still all works out. And also, when you met Miss Woods yesterday, right, this class met her, and she talked about, oh, they didn't?
They didn't see Miss Woods, right?
Yes. So the one with the tablets, right? She talked about how your passion in high school is going to be likely your passion when you get out of high school. It rings true for me, right? Because my passion in high school was to be in medicine. And then now I'm going back to that. So kind of sticking true to yourself is really important too. And knowing that a career in medicine and wanting to go to school to end up in some sort of medicine, you need to be dedicated. It's not a major, science is not a major that's easy, especially at a school like UConn. It's very competitive. And you need to be willing and ready to give your time to that. And be really ready and willing to study. There's many times where I could have been going out with friends, doing other things, and I chose to study instead. There's many weekend nights where I studied. And because of that, I was able to accomplish what I wanted to accomplish. I proudly say I never received a C in college, not once. I think my lowest grade was a B. My lowest final grade was a B. And I worked really hard for that, and I'm proud to say that. And college comes with a lot of distractions. It really, really does. And it's up to you to figure out how determined you are to accomplish what you want to accomplish. So I think that's another thing I just want to kind of reiterate. And PA school is very, very competitive. It's like the new up-and-coming profession. Every other student I talk to wants to be a PA. There was 1,600 people that applied to PACE's PA program. 1,600 people. They interviewed 200, and 80 people got in. It's crazy. I still honestly can't believe I got in. I'm still in shock, especially when they told me there were 1,600 applicants. That's a lot. So it's not the easiest thing to do, but it is doable. You can accomplish it.
You said during PA school you have the year or the clinical.
Mm-hmm.
You said you get paid during that.
Mm-mm.
So
nope.
You said you don't have time for a job.
Nope. You get paid with knowledge. Yeah. Nope. So you are paying to go to that. PACE's PA program, all said and done, is about 90 grand for the 2 years. So that's 45 grand a year. And so that second year, and a teacher's salary is pretty comparable to that. Teacher salary makes a new teacher in Manchester makes roughly $50,000 a year. So next year I'm going to reverse what I'm doing. I'm now making that money, and next year I'm going to be spending that much for the next 2 years. And unfortunately, that's just the cost of education. So my parents can't afford to send me and pay for it. So I will be taking out loans. And I'm actually applying to a scholarship that would actually pay my whole education and give me a stipend to live off of. So fingers crossed I get that. It's very prestigious. I'm very doubtful. Again, I was doubtful I get into PA school too though. So, but if not, I will be taking loans. But there's also programs that help pay back your loans. So once you're out of college, even like education, if you work in areas of high need, quote unquote high need, the government will start to forgive your loans. So if I don't get that scholarship, I will go through the loan repayment program where they will start to knock off my debt. So, yeah, go ahead.
You said you were a CN?
Yep, CNA.
When you were doing your hours?
Yep.
Do you have to be like a registered to get hours, like with
So,
education, or how like?
Not necessarily. So it depends on the program. A lot of people I talked to who got into PACE's program, PACE accepted scribe hours, which I thought was interesting. Medical scribes, I thought that was really weird. So technically, like, you should find a job or find volunteer that allows you to, like, it's weird to say, but like physically touch the patient. So you're taking blood pressure, you're taking temperature, you are helping with daily living activities like feeding the patient, dressing the patient, changing the patient, showering the patient, things like that.
So it has to be like in a nursing generally?
Not necessarily. I worked at an urgent care facility, so that was completely different. That was like really medical. But you can't be like behind a desk, if that makes sense. It has to be like physically contact.
And that has to be throughout your undergrad years?
It depends. It's up to you how you do it. If I were to do it over again, that's what I would have done. I know a lot of people who worked as a CNA, and I have a friend who actually went to Mercy College for PA, and she worked, I think, her 4 years, and she got a lot of hours that way. But she worked like part-time on the weekends. Like sometimes, some weekends she worked, some weekends she didn't. And the hours do accumulate, and then you have your summers too, where you can work. So yeah, that's what, if you are thinking about becoming a PA, I would become a CNA. It's the easiest. They also take like EMT. The EMT is a lot longer of a course and more expensive. CNA is like quick and dirty. You do the grunt work, I'm not going to lie, but
how long did it take to do CNA?
I took a 2-week course in the summer. It's very quick. It was about $1,200. So it's like a little expensive, but it was very quick and it's easy. But again, you're going to have to be, it's going to be more nursing stuff, and it's not always the cleanest, funnest job.
When you were touring the facility, tell this group some of the role play, because
Oh, okay.
they will be able to see the transition, that's kind of what we're looking to do.
Right. So one thing that was really cool about PACE that like made me fall in love with PACE in general and made me realize I really want to go to this program was they gave us a tour of the facility. So they have a room that's about the size of this, maybe a little bit bigger, and they have patient beds like along the wall with curtains. And they have these things called sim people, which kind of look like our little CPR guy, but they're more high tech, and they're hooked up to, and they're like machines, they're like robots. And the teacher you can hook them up to like EKGs and stuff like that, and the teacher can make the patient go crazy and like make all these problems happen, and you as a team have to figure out how to solve that issue and how to fix the problem. They also have the beds there, so we'll learn to do tests on each other, like we'll learn to do the physicals on each other. Obviously female students will probably be paired with females, males with males. And we'll learn to do like looking at your eyes, looking at throat, listening to lungs, things like that on each other. And they have the curtains, obviously, because if you're going to be in like the Johnny, you want to be able to have privacy. And then around the corner from there is this hallway, and it looks like a doctor's office. It has 4 rooms, and every single room is set up like you would see at a doctor's office. There's a bed, there's all the equipment on the wall, but the difference is that there's this little black bulb globe that sits up top and has a camera in it with a microphone. So your teacher, they'll hire in paid actors. Obviously it's New York City, so they can like find actors real easily to come in. And the actors will sit there, just like Miss Lambert does with your mystery patients. They'll come in and sit there and they'll tell us their symptoms, and we'll have to try to diagnose them. They'll record us so we can then watch ourselves back, and we can see what we did right and wrong. And then our teacher can also watch us live and grade us as we do it. That way it's more like real, and they're not like sitting there in the room with us, but they can still see us and hear what we do. So it's really cool. That stuff is cool. And what they do differently that you guys will never do is when it comes to, because it is medicine, so obviously we need to do things like vaginal exams and prostate exams and stuff like that, and they will hire in people to come do that and practice for us. So they'll pay them to come, and we will give them those exams as well. Obviously that's kind of strange to think about, like paying someone to come in so you can do that, but it is something they do as well. And we'll do that in those rooms. I think she's stretching.
Did your sister's boyfriend get into the program?
She did. He did, yes. He did, yeah. So yeah, it was really weird. So he's going as well, which is awkward. But I mean, he didn't break up with me, he broke up with her, so I mean, I don't expect to be friends with him.
How come you couldn't tell anybody when you got into the school?
So it's more like, how do I want to phrase this? I wanted to A, make sure it was secure and cemented, and B, you never want to, I didn't want people to doubt that I was going to stop doing my job. I think that was the biggest thing, and I wanted to make sure I told them at the right time. I didn't want to tell them too soon, I didn't want to tell them too late. So I told them in March, because that's when they start to hire. And also I think I just wanted to, I knew I was going, but I think it was kind of a cement with my decision, and I wanted to kind of mull it over in my brain too, figure out the best way I wanted to do it and how I wanted to do it. Anything else?
You guys can revert to your sheet to see what else is going on.
I don't know, there's something I didn't say here that I said to the other class. So.
Did you have to take?
Oh, I know what I was saying. So to apply to PA school, you need a few things. You need the hours, the patient care hours. You need experience, which is different than any other. Like med school, you don't need experience. Dental school, I don't believe you need experience. Things like that. You need a bachelor's degree. But the cool thing about that is you can have your bachelor's degree in anything. So you can have a bachelor's like in art history and still apply to PA school. You just need to make sure you have the prerequisites necessary to go to that program. So things like chem, bio, biochem, orgo, anatomy, microbiology, genetics, all those courses. As long as you took those, you can still apply with whatever bachelor's degree you have. And you need a minimum science GPA of 3.0, so that's a B. And you need a minimum cumulative GPA of a 3.3, I believe, which is a B+. So it's kind of different. Like med school, you need that like high A average. PA school, they look more for a rounded, well-rounded patient or well-rounded applicant. So well-rounded meaning that your GPA might not need to be as high, but you have this outside experience you're bringing into the table instead of just coming straight. You studied hard, you got A's, now you're going to med school to get that experience. You're coming in already with a little bit of experience. So that's a little bit difference between med school and PA school. It is highly competitive though. If you have, just because you have a 3.0 GPA does not mean you'll get in anywhere. It just means that you can apply. Any GPA they get that's below that, they're just going to automatically chuck your application in the trash. So it's like pointless to apply. You're wasting your money. The application you do is called CASPA. It's an online application that gets sent out to most PA programs. There's a few PA programs that don't go through CASPA, but you have to get letters of recommendation. You have to get 3. One academic, so one from a professor, one non-academic, but medical, and then they recommend one from a doctor or a PA. So those are the 3 you need. You need to write a letter, you need to write an essay of why you want to go to PA school and why you want to be a PA. You also need to pay about $300 per program you apply to. So it's obviously very money driven. So CASPA is the application you need to do. It's kind of crazy. You have to fill out a lot of different things, work experience, things like that. The interesting part is when you put down your hours, they don't actually make you verify them on the application. The program that makes you verify them once you're accepted. So you could lie and say you have all these hours, but if you then get accepted and can't prove it, you're just going to get booted out. So that's kind of interesting. But you need to have a competitive GPA. There's definitely no other way about that. A lot of programs say you cannot have a C in any of the prerequisite courses, which means you cannot have a C in, like, again, chem, biochem, orgo, anatomy, things like that. And that sounds a lot harder than it actually is. I'm not sorry, that sounds easier, I think, than it actually is. It's actually very hard not to get a C. In the classes, it's very, like, it's just a very tough workload to take. So, not that it's impossible, but just know that you'll be working, for sure. But it's worth it. I don't regret any amount of time I spent studying at UConn. I don't regret it at all.
If you could go back, what would you major like in throughout undergrad?
Biology, still. I would still do biology, yeah. Yep. Bio is just the easiest one because most of the courses you're going to take are going to be the prerequisites anyway. So it's kind of like, it just makes sense. Like if you're in bio, you're going to have to take bio and chem and orgo and biochem. So it makes sense to be a bio major because you're like killing 2 birds with 1 stone kind of thing. You have to do it for your major, you have to do it for the prerequisites. That's what I would recommend.
Any other majors?
You can do like health science and stuff like that, and you can be a chem major. You can really be whatever major you want to be. But most people that apply were typically bio majors, I think. Like chem majors. A science major, I think, is appropriate. If you're interested in something else though, and you don't know, be that major, and then just make sure you get the prereqs in. Still do it.
I'd like to open it up to this side of the room. A question from this side of the room would be great.
What don't you like about your job?
Okay, then let's reframe it. What are you nervous about for PA school might be?
Yeah.
What am I nervous about for PA school? I am nervous. It sounds silly, but it's that insecurity that I'm not smart enough, even though it's true. No, it's absolutely, it's true. That I won't be able to handle the coursework. And I will be very nervous when I start clinical because that's going to be something I've never done before. I've studied before. I know how to study. I just kind of getting back into it, kind of shaking off the cobwebs because it's been 3 years since I've actually sat down for an exam and studied. Because in grad school, for education, you write papers. That's pretty much what you do. I rarely took a test for my master's degree. But for my bachelor's, I took many tests. So kind of shaking off those cobwebs, getting used to studying again. The course load itself is going to be a lot, so I'm going to have to study a lot. I'm going to be in class a lot. And then probably clinical makes me really nervous too because that's going to be something I've never done before. I've never gone into a room and tried to diagnose someone. So that'll be nerve-wracking for sure.
Where else did you apply?
I applied many places. I got flat out rejected from a few. I got like, you're still kind of in the running, but we haven't offered you an interview yet. PACE is the only place I ever interviewed. I applied to PCOM, which is Philadelphia or Pennsylvania College of Osteopathic Medicine, Rutgers. Rutgers, I'm gonna like forget now. King's College, I'm trying to remember my list. After I got rejected from that, I kind of just forgot about them, honestly. Pace was my #1 choice, so, and I'm not just saying that because I got in. It really was, it truly was my #1 choice. Yeah, a couple. I can't remember where else. A lot in Philadelphia, actually. Because there's, the ones in Connecticut are Quinnipiac and Yale, and they both require, oh, and Bridgeport. They both require a lot of hours. I was going to apply to Bridgeport, but their deadline is earlier, so I didn't feel like I had enough hours yet, so I didn't put my application in. And actually, so programs get accredited, and like, so they get, there's like a board that says like if they're accredited or not accredited, and Bridgeport got like kind of slapped on their wrist, and they're like got back to provisional, so like technically it would be a risk if I went to Bridgeport, so I was kind of glad I didn't apply there. But those are the 3 in Connecticut. Quinnipiac wants over 2,000 hours, which is like pretty much working for 2 years once you get out of school. And Yale, I don't remember seeing Yale stuff, but I mean it's Yale, so I'm sure it's hefty. So, oh, and I applied to Northeastern in Boston. Any other questions? Jared has a question.
No.
Oh, okay. No?
Yeah. Does it sound hard?
Yeah.
Yeah.
That's what she said.
While she's scared, is it a good fit because she's excited about it too though? So hard is okay as long as it's a good fit for you.
Right.
And you're willing to do the work to support that. Does that make sense?
Right.
As you're making future decisions, it's very important to get the good fit.
And college should be about your education in general. I mean, of course, college is about also making friends and having a good time and doing things you like. But if you stay focused throughout college about just maintaining your education and maintaining that's your priority, what I did to do that, because I'm human too, like I sat through my anatomy lecture sometimes and was on Facebook the whole time. I sat down and calculated out how much each class cost me, and it's somewhere around like $200 to $500 every class you go to. That's how much it costs. That makes your butt go to class and pay attention. So it's doable.
To be a student, you have to be like